Welcome. Assalamu alaikum. This is uh, one of the components of chemotherapy, anti-cancer drugs. As we mentioned before, chemotherapeutic drugs are classified into antimicrobial and anti-cancer. So today we will deliver two anti-cancer and immunosuppressant drugs and anti-cancer by Dr. Mu'tasim Siddiq Muhammad Saleh, Associate Professor of Clinical Pharmacology, Faculty of Medicine, the University of Al-Imam Al-Mahdi, Kosti, Sudan. So definition of cancer. Cancer is unregulated proliferation of cells due to loss of normal controls. Also, cancer may develop in any tissue or organ at any age. Causes of cancer. Many theories mention that causes of cancers. Smoking is the first cause. Sometimes some people say that chemicals are the main uses, the main anti-cancer causes. Types of tumors. Types of tumors, benign or malignant. As you know from your pathological knowledge that tumors are either benign or malignant. Cancer chemotherapy aim to give palliative palliation, for example, prompt relief of unpleasant symptoms such as superior vena cava obstruction for uh, metastatial tumors, induce remission, and some also aim for cure. Classification of anti-cancer drugs. Anti-cancer drugs are either classified according to their chemical structures or due to classified due to their biochemical mechanisms or according to the cell cycle or phase specificity of the drug. Classification of anti-cancer drugs according to chemical structures. Uh, they are classified into alkylating agents, antimetabolites, antibiotics, plant extracts or plant alkaloids, hormones and their antagonists, also miscellaneous or others like radioactive isotopes are also used for some tumors, treatment of some radioactive isotopes, radioactive iodine or radioactive phosphorus can be used. According to their biochemical mechanisms, anticancers are classified into some of them block nucleic acid biosynthesis, others directly influence with structure and function of DNA after it is synthesized, so they interfere with the structure, the function of DNA. Interference also with transcription, so they block RNA synthesis, interference with proteins, some of them, influence of hormones, and classification according to the cell cycle or cell phase specificity. Cell cycle non-specific is CNSA or cell cycle specific agents like or abbreviated as CCSA. Mitosis, as you know, the stages of or the phases of cell division: M mitosis or mitosis phase, G1 growth 1 phase, S phase DNA synthesis, or G2 phase, and so on. So this is a summary of cell cycle, cell cycle or classification of drugs according to cell cycle specificity. Antimetabolites act on S phase DNA synthesis. Also, hydroxyurea, bleomycin act on G2 phase. Antimitotics act on mitosis or M phase, and so on. Uh, Cell cycle specific agents and cell cycle non-specific agents. Cell cycle specific drugs or non-specific drugs like alkylating agents, platinum compounds, antibiotics like bleomycin and donorubicin and doxorubicin. Cell cycle specific agents like uh, antimetabolites, topoisomerase inhibitors, zinc alkaloids, bleomycin. The mechanism of action of anticancers, as I mentioned before, blockade of DNA synthesis. Some of them destroy DNA and DNA replication, interference with transcription, interference with protein synthesis. So, drugs that block DNA and RNA by synthesis, nucleic acid synthesis, antimetabolites like methotrexate, which is dihydrofolic acid reductase inhibitor, pyrimidine antagonists, folic acid antagonists like methotrexate, pyrimidine antagonists like 5-fluorouracil, 5-fluorouracil, and citarabine. Purine antagonists like 6-mercaptopurine. 6-mercaptopurine is used for some tumors and also used as uh, anti uh, immunosuppressant. Ribonucleosides like hydroxyurea. Hydroxyurea is a ribonucleoside drug antagonist. Interference with protein senses like antitubulins and zinc alkaloids and texans. Texans are antitubulins. Also, L-asparaginase, which is enzyme act as cancer. Some of them, like doxorubicin, bind with DNA and then block RNA production. Influence of structure and function of DNA. Alkylating agents, miclorethamine, cyclophosphamide. Cyclophosphamide is used as anti-cancer and as immunosuppressant. Also, thiotepa, platinum compounds, cisplatin, oxaloplatin, carboplatin, antibiotics like bleomycin and mitomycin C, topoisomerase inhibitors, iontican, camtothecin, and odophillotoxin. Anti-cancer drugs, continuation, or antineoplastic drugs, alkylating agents, antimetabolites, these are the chemical groups that alkylating agents were being discovered in First World War as warfare. They were being used as warfare. So they can inhibit the growth of cells, especially bone marrow, and so they are toxic for cells. Nitrogen musters inhibit cell replication by binding irreversibly to nucleic acid DNA, the specific type of chemical bonding involved in alkylation. So they can cause alkylation. Bischloroethylamine, cyclophosphamide, bischloroethylamines, cyclophosphamide, chlormethamine, chlorambucil, nitrosoureas, carmustine, lomustine, uh, ethylene, ammonium, ethylene ammonium, or aziridine, thiotepa, triethylene, melamine, also alkyl sulfonates, busulfan, sulfur mustards, and nitrogen mustards in general. So this is in conclusion. Nitrogen mustards and uh, sulfur mustards are alkylating. Resistance to alkylating agent can be developed and reported all over the world. So this may be due to one of the causes is that membrane transport may be decreased. Also, the drug may be metabolized to inactive, or the drug is inactivated by metabolism. Uh, Adverse drug reactions in general of alkylating agents, myelosuppression in dose, which is dose limiting, adverse drug effect, nausea, vomiting are common also, teratogenesis, and other adverse drug reactions. So they are full of adverse drug reactions, alopecia, anemia. Alkylating agents, mustine. Mustine is given by intravenously by injection because it is highly reactive. The main indication of mustine is that it is used for Hodgkin's disease, Hodgkin and lymphomas, but it may also be useful in other malignancies. Alkylating agents, cyclophosphamide. Cyclophosphamide is used for treatment of chronic lymphatic leukemia. Non-Hodgkin's lymphomas may be used for breast cancer, ovarian cancer, and so on. So immunosuppression also is one of the uses for immunosuppressant. It is used for as immunosuppressant, one of the uses of cyclophosphamide. Adverse drug reactions mainly alopecia, nausea, vomiting, myelosuppression, and hemorrhagic cystitis. Also, alkylating agents like carmustine, lomustine, somustine. Pharmacokinetics, nitrosurias are highly lipophilic, so they can cross blood-brain barrier reaching cerebrospinal fluid. So they are used for brain tumors because they are penetrative to CNS. 30% of the plasma concentration is will be in the brain or in CNS. Phenylalanine, nitrogen mustard, milphalanine or milphalan. Milphalan is a nitrogen mustard that is primarily used for treatment of multiple myeloma and breast cancer and some ovarian cancer. Busulfan, this is also a drug administered by oral route of administration to treat choric granulocytic leukemia. It can cause pulmonary fibrosis, which is known as busulfan lung. Pulmonary fibrosis, nausea and vomiting are also adverse drug reactions of busulfan. Thiotiba, this is it is converted rapidly in the liver to by oxidation to active metabolite, which is known as triethylene phosphoramide. Triethylene phosphoramide, abbreviated TEPA, as you see in red color, in red letters. It is active in bladder cancer, used for bladder. Antimetabolites also general characteristics. Myelosuppression is dose limiting, toxicity. Antimetabolites, others like or antimetabolite drugs like folic acid antagonists or folic acid analogs, methotrexate, purine antagonist 6-mercaptopurine, and also pyrimidine antagonists like 5-fluorouracil and hydroxyurea. These are anti. Methotrexate is used for some. It is a cytotoxic drug used for breast cancer and some ovarian cancer. Also, it is used for rheumatoid arthritis or arthritis resistant to treatment by other anti-inflammatory or slow-acting anti-inflammatory drugs. So, methotrexate is used for metastatic meningeal tumors. Renal toxicity is one of the adverse drug reaction. Myelosuppression, leukopenia, sorry, leukopenia, bone marrow suppression, thrombocytopenia. All of these are adverse drug reactions of methotrexate, antimetabolites, purine analogs or purine antagonists. The clinical uses 6-mercaptopurine is used generally for treatment of acute lymphatic leukemia in combination with methotrexate for this purpose. It is well tolerated, but generally on long term it can cause hepatotoxic on long term use. Also 5-fluorouracil. 5-fluorouracil is used for various types of uh, tumors, solid tumors, head and, head and neck tumors, colorectal and gastric tumors, breast cancer, uh, squamous cell tumors. So it is used for various types of tumors. 5-fluorouracil, 5-FU, head and neck, breast cancer, squamous cells, gastric and colorectal. The adverse drug reaction myelosuppression is more problematic after bolus injection. Cytarabine Cytarabine has narrow clinical spectrum of activity used in combination with doxorubicin or thioguanine for treatment of acute non-lymphatic leukemia. Mainly, it can cause liver, hepatic, or renal damage. It can cause damage of liver, heart, tissues, organs, also hepato, nephrotoxic. Antibiotics, bleomycin, dactinomycin, doxorubicin, and daunorubicin are anthracycline or anthracycline derivatives. Daunorubicin and doxorubicin are used clinically for treatment of acute leukemias and lymphomas, and also for solid. Mechanism of action: mitomycin uh, is antineoplastic antibiotic that alkylates DNA, used for in combination with vincristine for treatment of breast cancer. Myelosuppression, platelet and leukocytes can be affected. Platelet and leukocytes can be affected as an adverse drug reaction of uh, Dactinomycin is also used for treatment of thrombo, uh, sorry, for tumors and treatment of pediatric tumors such as Wilms tumor and Ewing sarcoma. Bleomycin for Hodgkin's and non-Hodgkin's lymphoma, myelosuppression, serious toxicities, pulmonary and mucocutaneous reactions. Tubulin binding agents, drugs that like vinca alkaloids, vincarosa this is the name of the plant. Vincristine and vinblastine are extracted from this plant, vincarosa, so they are known as alkaloids. Vincristine and vinblastine, they are used for various types of tumors, but especially for lung and breast cancers. Tubulin binding agents. Also, texans are used as tubulin binding agents. They are of plant origin also, extracted from plant. Platinum compound cisplatin, various types of tumors, clinical uses. It is used for treatment of melanoma and other solid tumors. cisplatin can be used for treatment of pancreatic tumor. The main adverse drug reaction is that nephrotoxicity, hepatotoxicity, and severe nausea and vomiting. It induces nausea and vomiting. So cisplatin, nausea and vomiting induced by cisplatin are a challenge for the world. How to stop nausea and vomiting induced by cisplatin. So many drugs are um, tested for this purpose to inhibit or to block nausea and vomiting caused by and other platinum compounds. Carboplatin also is a second line drug for ovarian cancer. Hormones also, estrogen and estrogen antagonists are used, especially estrogen antagonists, blockers of estrogen receptor, like it, Mistrixate, tamoxifen straight is estrogen blocker used for treatment of estrogen dependent breast cancer. Also, fulvestrant is pure anti-estrogenic, so used for breast cancer as adjunctive treatment. Androgens and anti-androgenic drugs are used for cancer, prostate, flutamide, nilotamide, bicalutamide. They are used for metastatic prostatic cancer, suppress testicular reduction of testosterone to dihydrotestosterone, which is accumulated in the gland, leading to uh, increasing the volume of the gland. So, benign prostatic hyperplasia can be treated also by alpha reductase inhibitors, while cancer prostate or neoplastic or tumors, flutamide, nilotamide, bicalutamide are used for cancer prostate. Aromatase inhibitors used for breast cancer. As you know that aromatase enzyme is incorporated in synthesis of steroidal nucleus. So steroidal nucleus either uh, estrogen or testosterone or progesterone. So uh, the ring or the nucleus of estrogen can be inhibited by aromatase inhibitors like letrozole. Letrozole is used as aromatase inhibitor for synthesis of estrogen. So they are used for breast cancer. Aromatase inhibitors are used for inhibition of the steroidal nucleus of testosterone. So anastrozole and letrozole are used in combination or when tamoxifen is failed or failure of tamoxifen. Glucocorticoids, prednisolone also is used as adjunctive treatment for with cancer. The main problems of anti-cancer or antineoplastic drugs is that drug resistance and adverse drug reactions or the toxicity. They are highly toxic drugs. They can cause serious adverse drug reactions, as I mentioned, bone marrow suppression, alopecia, hepatotoxicity, sometimes nephrotoxicity like cisplatin and others. So the main adverse drug reactions are of antineoplastic drugs. They can stimulate chemoreceptor trigger zone, so they can lead to severe nausea and vomiting, alopecia, sometimes hepatotoxicity, bone marrow suppression, gastrointestinal disturbance, and hair follicles, disturbance in or loss of hair follicles. So alopecia can be patients suffer from alopecia. Radioactive isotopes also are used as anti-cancer, especially iodine isotope, iodine 131 is used for treatment of thyroid cancer and also for diagnosis to test the function of thyroid gland by measuring the uptake of radioactive iodine. iodine 131. Also, radioactive phosphorus is used for treatment of various blood disorders, polycythemia vera, and so on. Phosphorus 32. 32. Hydroxyurea is also used for treatment of sickle cell anemia, with sometimes with radioactive immunomodulators or immunosuppressants like glucocorticoids, as I mentioned, cytotoxic drugs, alkylating agents, antimetabolites, methotrexate, azathioprine, and mercaptopurine, drugs acting on immunophilins like cyclosporine and sirolimus. Cyclosporine is used to prevent tissue and organ rejection in tissue and organ transplantation. So cyclosporine is used to prevent rejection during or after tissue and organ transplantation. Also, sirolimus is used, which is obtained from Streptomyces species. Immunomodulators, as I mentioned, cyclosporine, tacrolimus or sirolimus, adrenocortical hormones, antimetabolites, alkylating agents, and so on. So, thank you for following and see you next lecture. Thank you.